What role do genes and environment play in rheumatoid arthritis diagnosis? Rheumatoid arthritis, or RA, is a complex autoimmune disease influenced by both genetic and environmental factors. Understanding how these elements interact can help us grasp the risk and timing of RA diagnosis. Genetic factors are significant in determining who may develop RA. Specific gene variations, particularly those in the major histocompatibility complex region on chromosome 6, are closely linked to increased risk. One key gene is HLA-DRB1, often referred to as the shared epitope, which has a strong association with RA susceptibility. Another important gene is PTPN22, which also contributes to this genetic risk. Research suggests that heritability for RA is around 60%, indicating a substantial genetic influence on the disease. These genetic markers can affect how the immune system behaves, particularly in terms of autoimmunity, which is central to the development of RA. However, genetics alone do not tell the whole story. Environmental factors play a crucial role in triggering or accelerating the disease in those who are genetically predisposed. Some of the most significant environmental risk factors include smoking, certain infections like the Epstein-Barr virus, diet, obesity, and exposure to various toxins. Among these, smoking is one of the most well-established triggers, especially for individuals who carry high-risk genetic markers. Other factors, such as socioeconomic status and geographic location, can also influence the risk of developing RA. The concept of epigenetics adds another layer to this discussion. Environmental factors can lead to changes in gene expression without altering the DNA sequence itself. For example, factors like diet and toxins can cause modifications that regulate immune responses and inflammation, contributing to the onset and progression of RA. Interestingly, RA often has a preclinical phase. During this phase, systemic autoimmunity can be detected through specific biomarkers before any clinical symptoms appear. Both genetic and environmental factors are at play during this phase, influencing when and if a person will develop clinical RA. This understanding is vital for early diagnosis and potential prevention strategies. In summary, the diagnosis of RA is shaped by the interplay of inherited genetic susceptibility and environmental exposures. Neither factor alone is sufficient. Rather, their interaction determines the risk, timing, and severity of the disease. This knowledge is essential for clinicians as they assess risk and explore early intervention opportunities. It is important to remember that individual experiences can vary widely, so personalized medical advice is always recommended.